School's back in session in the Quad Cities, but coming back with the students in some cases are cases of COVID-19. Local 4 News looked into just how much the pandemic is hitting the classroom tonight. That is our top story at 6 o'clock. We've learned at least 26 schools in Illinois right now are dealing with COVID outbreaks. 6 of those outbreaks are in the Local 4 viewing area, and outbreak means shared exposure from different households. Let's break it down, specifically starting in Rock Island County. Both Bicentennial Elementary School and United Township High School have what the Illinois Department of Public Health considers outbreaks of less than 5 students. In Henry County, Kelowna Grade School has a between 5 and 10 case outbreak of staff and students. Central Junior High School and Geneseo High School have outbreaks of less than 5 cases. And in Knox County, Rova High School has an outbreak of less than 5 students. Iowa's reporting system is a little different and less specific about actual schools, but here's what we know, and keep in mind there are likely cases not being reported here. Davenport Schools has 29 current cases. Pleasant Valley Schools has 26 current cases. Muscatine has 16. Central DeWitt has 7. Maquoketa has 4. And North Scott has 2. With the continued spread of the Delta variant on both sides of the river, handling cases within public institutes like schools differs between the state of Iowa compared to Illinois. Local public health departments want to minimize spread through methods like contact tracing. Local 4's Sierra Krug joins us with what those differences are. Sierra.
Yes, Jarek, the Iowa Department of Public Health does not require schools to report COVID cases unless more than 10% of the school is absent due to illness. In Illinois, however, local health departments do still enforce contact tracing, meaning if a student tests positive for COVID, those who sit within 3 feet of the individual are contacted and quarantined.
People are starting to do home kits that you can buy at Walgreens, etc.,
which can pose a problem for public health officials.
Those don't come to us.
Lack of information only harming the effort to reduce spread of the Delta variant.
We know that there are a lot of kids who are infected. We really do need the schools to tell us.
As long as the test was done at a doctor's office through the school, we would follow up with that case if they were in our county.
In the state of Illinois,
outbreaks are tracked by the Illinois Department of Public Health. We now have 11 contact tracers working for us, and they are very busy because cases have increased rapidly.
But even when cases are reported in a classroom, not everyone in that class is considered a direct contact and quarantined.
Only people, as long as everyone was masked, only people within 3 feet of the case.
Over in Iowa, cases are only reported after an outbreak. With the rapidly spreading Delta variant, health officials say they aim to prevent outbreaks rather than remedy them.
Contact tracing is the basis of public health. This is how we can spot outbreaks and try to tamp them down before they become just overwhelming.
In Illinois schools, contact tracing means informing and quarantining those who were exposed to someone with COVID.
We will follow up with them with a phone call, place them in quarantine, explain that quarantine is still technically the 14 days after an exposure.
One of the very big benefits of being vaccinated, that if you are exposed, you don't have to quarantine. Older children, if they have been in a classroom, even if they are sitting next to a child and they are not symptomatic, if they are vaccinated, they do not have to quarantine.
Of course, with the circumstances of the pandemic and all of its variants progressing and changing each day, protocol and health department policy is subject to change along with it. We will keep you updated at ourquadcities.com. In the newsroom, Sierra Krug, Local 4 News.
Sierra, thank you. The Illinois Senate approved a massive climate and energy bill late last night. Now